All right. Do I have screen sharing abilities?
Yes, you should.
So I could, okay, cool. And then actually, can you, if you go into participants by my name, can you go to more and then just allow me to record as well? I'll record it so it just as a backup.
Yeah.
Perfect. Cool. All right. How's everyone doing? Can I see in the chat? I'm gonna try and make it the talk interactive. So what I like to do is use a 6 in the chat as a thumbs up and a 9 as a thumbs down. Can everyone hear me? Can I see a 6 in the chat from some people if you're with me? All right, there we go. Beautiful. All right, we'll give people a couple of minutes to hop on. The way I think this is going to work, and Bisma, you can correct me if I'm wrong. I'm going to go through a PowerPoint presentation, kind of my spiel, my talk that I usually give students, but I want it to be as interactive as possible. So if you do have questions as I go, feel free to write in the chat. I probably won't get to all those questions in the beginning while I'm talking. If it seems relevant to, let's say, the slide I'm on, I'll try and address it at that point. If it's like something completely different, then I'll make sure to get to all those questions at the end when we open into a Q&A. Does that sound good?
Yes, perfect.
Awesome.
Okay, before we start, I just want to remind everyone to maintain proper etiquette and please keep themselves on mute unless Adam specifies otherwise. If you have any questions, please post them in the chat and we will address them as we proceed through the session. A Google survey will be administered for Wayne State University students at the very end of the session to verify your attendance, and will close 30 minutes after the session terminates. Please stay on the call for at least 5 minutes after the session is over to ensure that the survey is working for you. This session will also be posted on YouTube in case you are unable to attend or want to revisit certain topics Adam discusses today, but you cannot receive attendance hours if you are not present in this call and complete the survey. Thank you.
Thank you, Valerie.
All right. Can I just, before we get started, I like to get a feel for the audience. So can I see in the chat what year everybody is? All right, I see junior, freshman, sophomore, okay. All right, so we're spanning freshman, sophomore, junior. Any seniors in here? Oh, I see one senior. Okay. Anyone in a post-bac year? All right, and who, can I see a 6 in the chat if you're gonna start preparing for the MCAT within the next 6 months, and a 9 if you're not. All right. So decent amount of people. What about 6 in the chat if you've already started preparing for the MCAT? All right, not as many, but still a few. All right, cool. All right, so I'm gonna start the screen share. And again, feel free to put in the chat any questions that you guys have. I'm gonna try and monitor that as I go through the presentation. Right now, I don't have screen share ability.
Okay, give me one sec.
Yep, no problem.
You should be good. I would try now.
Yep. Great. All right, I'm just gonna pull up the chat so I can see it while we're going. All right. Perfect. All right, everyone can see me and see the screen. Cool. And then one more question and then we'll get started. Just out of curiosity, who here is familiar with me or knows anything about me? Can I see a 6 if you've seen my stuff on social media or whatnot, and a 9 if you haven't? Okay. So we're about split 50-50. Actually, maybe more people don't know me than do, but that's all right. So I'll give you a little bit of background on me as we get into it. All right, guys. So welcome to my talk. Mainly, the goal of this will be how to optimize yourself as a pre-med student. That's mainly what I'm going to be covering today. All right, so this is my promise to you. By the end of this talk, I want to give you at least one tactic or strategy that you can implement to become a more productive student so that you will not only get better grades, but will have more free time. So by the time you leave this talk, I want there to be at least one change in something that you're doing right now as a pre-med student so that you will be able to free up more time, start seeing better grades, be more productive. And if you could just leave here with one thing, hopefully more than one, but just one, I think I'll be happy, and I'm hoping that you get a lot of value from this talk. All right, and here is obviously the ultimate goal. Here's a couple pictures of me in medical school. On the right, you have my anatomy group. That was my first year of med school. Actually, most of these pictures were first year med school. As you can see, I grew up the beard a little bit on the left, so that was more recently. Although once I get back into the hospital, I'm gonna have to shave the beard for Corona purposes because you can't wear that N95 with a good fit unless you're clean shaven. All right, so my goal for you today. First, change the trajectory of your pre-med career and teach you how to start getting better grades immediately. I want you guys to be able to take action right after this talk. And from 4 weeks from now, I want to hear somehow, maybe you can message me on Instagram, that some of the things you've learned here, you were able to implement and start seeing better grades. Second, I want you to be able to prepare for the MCAT using the most effective study techniques used by medical students to ace their boards. We're going to get into that. And even if you're not about to start prepping for the MCAT, this will be helpful info that you could use for classes as well. So there's a lot of overlap. And then when you get to MCAT study, you'll be prepared to know exactly what to do. And I think you'll notice some differences from what a lot of students do to study for the MCAT and what you actually should be doing. And 3, I'm going to teach you 3 application tactics that will instantly increase your chances of getting accepted, or chances of getting that acceptance into medical school. All right, a little bit of background on me. My name is Adam Nessim. I am the founder of the Pre-Med Consultants, which is an academic consulting company and pre-med coaching program. Basically, we help students every step of the process, from whether you're a freshman or just about to start preparing for the MCAT. Everything you need to properly excel as a pre-med student, we help you with. There's a full MCAT program in there, admissions program, and pretty much everything you need, we got you covered. So that's what I do aside from being a medical student. I used to work for one of the major MCAT prep companies and left them because I wanted to create a program where the mentorship was more long-term. So once you join the program, you are a member for a lifetime until you get that medical school acceptance. And I really enjoy that long-term mentorship. And so that's kind of why I left to start my own company. I graduated from Cornell with over a 4.0 and over the 90th percentile on the MCAT. I don't say that to brag. Honestly, I could care less about that. The reason I say it is because I am no genius by any means, but some of the strategies that I have been able to figure out along the way, and especially when I even got to medical school, I was able to use to start getting good grades and doing well in these types of exams. And the point I'm making is that you can do it too, no matter if you're struggling right now as a student. And you feel like, oh, all pre-meds, all medical students, they're these extremely smart people and I'm never going to get to that point. That is not the case at all. A lot of this stuff comes down to being able to study well, being efficient with your time. And so if I could teach you how to do that, then I can walk away from this talk happy, because I want you to be able to believe in yourself and know that you can really do it. You can get into medical school. You can get a 4.0 GPA. Maybe it's not, cumulative if you've already had semesters, but it could be just your last semester or the next semester, you're going to get that 4.0. So I want you to just really strive for that. And we'll talk about some tactics, actual things you could use so that you could hopefully be able to do that. And I'm a fourth year medical student at Albert Einstein College of Medicine in New York. I'm actually on a gap year right now, so it's a little confusing. I finished the first 3 years of medical school, and now I'm on a research year. So I'm doing research in orthopedic spine, and then I'll start fourth year next year. So I'll technically graduate in 5 years in medical school. That's a little bit more common now, similar to how lots of pre-meds take gap years after medical school or after undergrad. It's now more common for med students to take gap years as well to do research, especially if you're thinking about a competitive specialty. And you might have seen my stuff on TikTok or Instagram. That's how a lot of people find me, but I've been doing this stuff well before I was on social media. All right. The thing is, I put the 4.0 in the previous slide to contrast the fact that actually on my first ever exam at Cornell, I got a 68%. And coming out of high school, I'm sure most of you did fairly well in high school. Most pre-meds do. You get to college and you realize it's a whole nother ball game, and it's a lot more challenging than you might have thought. And it's going to really require proper study techniques to do well. So when I got that first exam and I got a 68, I mean, I had never gotten probably below a 90 in high school. So it was a huge shock to me. And I realized that what I was doing must be wrong, and that I had to figure out how I'm going to go from there and actually implement study methods that are going to work, especially in competitive pre-med classes at Cornell. So I really went deep into learning science and understanding how to be efficient with my time and how to actually properly study, which is, I think, something that a lot of students are never taught. I don't know why it's never taught in school. I think it would be a great class in high school if they actually had a class on learning how to learn. And honestly, even until I got to medical school, there were things that I wish I had known earlier on as a pre-med student. And so that's why I think talks like this are great. And like, that's this type of stuff I try to teach in my program. And so that's what we're going to go over today. Any questions so far? Is everyone with me? I see a 6 in the chat if you're hearing me. All right. Beautiful. All right. So I know the semester is we're a little bit into the semester, but I want to go over how you would start off any semester strong, and you could still implement these things even though the semester has already started. So the first thing I tell all my students is to get ahead in your classes and do it early. So this would usually be studying for those classes before the semester even starts. But if, let's say you just finished your first exam in whatever classes you're taking this semester, you basically have a reset and an opportunity for that second exam to get ahead. And so what I want you guys to do is, instead of just going to class, doing the assignments and studying after every class, and then really your main studying is going to be cramming a week before the exam. Here, give me a 6 in the chat if that's what you generally do. About a week before the exam is when you start your studying, maybe even less. Yeah, that tends to be the case for most pre-meds. Day before, I see. All right. So yeah, and it's very common. And I think the problem with it is it makes pre-med a lot more stressful. In the time when you're not cramming early on, it's great because you're like, oh, I don't have a test for a while, and so I'm not going to have to worry about it. But then that last week or the day before, whenever it is you start that cram mode, is more stressful. You honestly will not do as well as you would have if you just started using proper study tactics in the beginning. And so that's why I tell students to study for every class. Like each Friday, there's a quiz. So you should be trying to learn that material and getting ahead in that material before, basically for every lecture, not just right before an exam. Another thing you should all be doing is actually start practice exams after the first few weeks into the semester. Why would I suggest, if your class has, let's say, a practice exam or two, that you do it earlier rather than a couple days before the exam, which is what most people will do? Does anyone know? Can I see in the chat some ideas? I see Sharon said exposure to material. Anyone else? Why would I say do an exam even if you've not learned half the material? Exactly. Helps you get an idea of what to expect, so you know what you need to study, get a feel for the questions asked. All great answers. Exactly. And who here does this? Does anyone look at practice exams really far out, or is it usually a week before the test, if not the night before? Yeah, that's usually what I see is most people won't do it until a couple days before the exam. So one thing you can try this semester is working on those practice exams early on. A few reasons you guys hit on. Additionally, one, doing practice questions is proven to be one of the most effective ways to study because it's active recall. You actually have to see how well you know that material. You can't hide from practice questions. When you're copying down notes or highlighting or reading textbooks, you might feel accomplished at the end of the day of studying, but you don't really know how well you know that information. When you are taking practice tests, not only do you have a good assessment of what you know and what you don't know, but you'll start to remember that information better because who here, I'm sure everyone is familiar with this, where you got that one question wrong. That was the difference between you getting a B and an A on an exam. And you remember that question for like the next semester, if not year, if not, you probably still remember it. Has that happened to anyone? Can I see a 6 in the chat if that's ever happened to someone? Yeah, everyone knows what I'm talking about. Love it. Exactly. So when you're doing questions, it's much more sticky with your memory. And they've done studies that show, especially for big standardized tests like the USMLE, which is the board exams, and even the MCAT, the more practice questions you've done and reviewed, it's very important, the review part, because we just do the practice questions, you don't get as much out of it, the better you're going to do on that exam. So they actually will correlate, and they've kind of taken the numbers and have seen that the more, let's say, board questions a medical student has done for the USMLE, it is going to positively correlate with the score that they get. So if there's anything you want to be doing, it is questions from the very beginning. And that's why if you do those questions early on from that practice test, one, you're going to know what material is actually important as opposed to the ridiculous amount of textbooks reading that you have, but then only a very small percentage of that is actually being tested. Now you can hone in on what's important, and don't think of it as a waste, because even if you do that, a lot of students will say, oh, I'm going to waste the practice test. I don't care if you do the practice test 2 days before and then get a score, because now all you're doing is figuring out, all right, what score are you probably going to get on the real thing, and or how much can you improve with that in those 2 days, as opposed to do it a couple weeks out, then do it again a couple days before. It's not a big deal if you remember kind of some of those questions, because what you'll notice, and I'm sure you've seen this before, on the real exam, a lot of times those questions are very similar to your actual practice tests. And that's why they give you those practice exams. Not always, and obviously they'll change variables and scenarios, but a lot of times you can get a really good feel for what's going to be on an actual class exam from those practice exams. So if there's something you should all try this semester, try doing those practice exams early on. Maybe that's next week you sit down and you actually review the practice exam. All right, next is using spaced repetition. Who here, can I see a 6 in the chat, knows what spaced repetition is? Right, mainly yeses, some no's, which is pretty good actually. Usually most people don't even know what I'm talking about. And who here has used Anki before? Can I see a 6 in the chat if you've used Anki, a 9 if you haven't? Wow, that's pretty good. It used to be when I was pre-med, no one even knew what Anki was. I think through different talks like this, probably you might have seen me talk about it on social media or other people, it's trickling down into pre-meds, but it used to be no one was using Anki. So what Anki is a spaced repetition platform, which allows you to see the information at the most likely time you're going to forget it. So for example, if you see a flashcard on the citric acid cycle today and you get it right, you'll see it tomorrow. If you get it right tomorrow, you'll see it in 3 days, and then 7 days, and then 2 weeks, and then a month, and then 3 months, and you're just constantly going to push that information into your long-term memory. So if, for example, you go to class, you review the lecture slides, and you make Anki flashcards based on the important information on those lecture slides, because let's be honest, most of those tests, 80% are going to be just tested from something from the lecture slides. If you have those memorized cold, you're doing well. So if you put those into Anki decks and you do your Anki cards for 30 to 45 minutes every day, that's it, 30 to 45 minutes just to finish all the cards you have from lecture. By the time you get to that 1 week where you would usually start your study cramming, you're going to have almost everything memorized in that class. And that's only from 30 to 45 minutes. Maybe as you get closer to test day, because there's more cards by that point, it's an hour to an hour and a half tops. If you just do that 1.5 hours of Anki, you will start scoring significantly better than probably whatever you're doing now, unless you're getting straight A's already, then I'll shut up. Does that make sense to everyone? And why spaced repetition is so important? And the best part is when you do this, it opens up more time for you to hang out with friends. These days, that's a little bit more tricky with COVID. Do other extracurriculars, relax, watch your favorite Netflix shows. I guess now there's also Amazon Prime, Hulu, HBO Go, lots of networks now. We'll get good show recs at the end because I need a new show. All right, and last one, wake up early and study before class. Can I see a 6 in the chat if anybody here does that? Ooh, wow. That's too many 6s, I don't believe it. All right, I'm thoroughly impressed. This must be a very go-getter group. I have all 8 a.m. classes, so I have to wake up. Yeah, but do you study before the 8 a.m. classes? So my students in my coaching program know we're waking up I hold office hours at 6 a.m. to 8 a.m. right before anyone's 8 a.m. classes so they can get their studying in the morning. So a couple points on this. Basically, what most students do, it seems like you guys are not most students, is they go to class, they haven't reviewed the lecture slides or whatever it is for that class. Let's be honest, half the time you're not paying attention to that lecture. It's hard. The professor usually talks slow. Sometimes they're not very engaging, and you don't learn any of the material, maybe 10 to 20%. Then later that day, you try to actually teach yourself that material, and then you actually have to study it at maybe the next day or the day after. Now, what if we flip that on its head and we woke up early, which seems like most of you are doing? You study the lecture slides, you put it into Anki flashcards. Now you go to class and you just listen, and you're actually able to absorb and pay more attention because you don't have to be stressed out rewriting all the notes or trying to actually understand what the professor is saying, but really you're filling in the gaps of what you've already studied. So that's technically your second pass. And then you finish your Anki cards and do the reviews the next day, and now you've already done 3 passes through the information. Does everyone see how that's like a big difference just from waking up early and studying before your lecture? Good. And if you guys are doing this, if you take these 4 things, get ahead in your classes, start your practice exams early, use spaced repetition. If you're actually making a lot of Anki flashcards and doing them every day, again, it shouldn't be more than an hour and a half. And that's probably even more than you would need. And you wake up early before class, there is no reason you shouldn't be getting A's in your pre-med classes, even though pre-med classes are hard. And I'm not saying that they're not competitive, but these 4 things, wherever you're at now, you should see a significant improvement. So these 4 things I really want you to try to implement this semester and moving forward. And these are not always easy habits to develop. There's a little bit of a learning curve, but I'm telling you, this is what all top medical students use, what a lot of the pre-meds that I find that were struggling before, and then they start implementing these strategies and they skyrocket with their grades. How are we doing so far? Is this helpful? Any questions? How are we doing on time? All right. I'll try and hurry up so we can open up to a Q&A. All right, very helpful, love it. I'm telling you guys, this is the secret sauce right here. All right, and last thing, no excuses and have high expectations. So pre-med is difficult, it's competitive. Only 40% of students each year get accepted to medical school. And what a lot of students will do is just go through the motions, their pre-med track, and so they assume they're just gonna get into medical school. That is not how it works. You do need to have a good academic standing, do well in classes, do well in the MCAT. I'm not saying it's the only thing, and there's lots of other factors. And I've helped a lot of students that had bad GPAs actually get into medical school. So I know it's possible firsthand, but you should have high expectations for yourself. You should be shooting for a 4.0 every semester, because when you shoot for that 4.0, even if you miss a little bit and you hit a 3.6, a 3.7, a 3.8, well, that's a pretty damn good GPA, as opposed to you're just taking the classes, whatever happens, happens. I guarantee you'll end up with a lower GPA that semester than if you were saying, I'm gonna get a 4.0 this semester. So setting your expectations higher for yourself is something I try to encourage all pre-meds to do. And that will be like the top motivation, and then you put in the tactics of everything else we just talked about, and you're golden. All right, now let's get into MCAT studying. So a lot of the principles kind of apply of what I just talked about, and so I'll run through this pretty quickly, but I want to talk about what the old method of MCAT studying is and compare that to the new method with these study techniques, and I call it the new method. I kind of just made that up, with the study techniques we've just talked about. So let's assume someone has a January test date and they're using the old method of studying. Basically, what most students will do is they're going to spend the entire summer reading almost all the major test prep MCAT books. So I'm sure you're all familiar with those big MCAT companies. I've worked for them before, and a lot of students, and I see this, will just read all the textbooks, highlight, and basically waste an entire summer. Has anyone done this last summer? Just read through all the textbooks, not really done practice questions? No. Okay, well, that's good. And if you did and you don't want to say it, that's okay too. All right. And then by the end, again, most people, when you're doing passive study techniques, they're just going to forget most of what they read. Then a lot of students will take a diagnostic exam, do poorly, and start freaking out. A lot of the times companies have you take a diagnostic test before you embark on the MCAT journey. It's just because that way they could say, look how much your score improved. Even if you didn't do that well, I promise you're going to improve like 10 to 15 points easily from your diagnostic, because that diagnostic score is going to be pretty bad. It's very rare for someone to have anywhere close to a good diagnostic score. If you do without any studying, that's amazing. But don't freak out when you do. And that's why I don't even encourage students really that they need to take a diagnostic without any studying. I'd rather you start doing practice questions and do the methods we'll talk about in a little bit before taking that like first practice exam. But if you want to take a diagnostic, totally okay to see your starting point and get a feel for what the test is like. But like I said, don't freak out about it. Then most students will start during their fall semester, and they will take one of those prep courses, which is a lot of lecture, actually a lot of lecture and a lot more reading of those textbooks. If you noticed yet, I have not said practice questions. All right, number 5, they'll do all the required readings for those classes, take notes, highlight, etc. And we kind of covered that already, but a lot of students will end up going to these long 3-hour lectures at a time. You're not even paying attention to half of it. It's after all your classes, you're already exhausted. And what you're forgoing is practice questions and review of those questions, which, like we already talked about, is going to be some of the most effective methods for studying for big exams like this. And then what students will do is finally, over winter break, start taking all these practice exams. And now they're on a deadline of having to rush all the AMC material, which is the most important material before the actual exam. And reviewing that thoroughly is by far the most important thing you can do. And they're struggling. And now during that winter break month where they're studying for, let's say, that January test date, that's where you're going to see by far the biggest score improvement. And the reason being is you're doing practice exams, you're reviewing it, you're doing more specifically practice questions, because you actually don't need to do as many practice exams as you might think. But questions is what's going to be most important. And instead of doing this for all 4 to 6 months of your studying, most students are only doing this in the last 1 to 2. So we kind of talked about this, but why is this method outdated? It's not using the most effective study techniques that are backed by learning science, and that is problem-based learning, using questions, and spaced repetition. So how do we change this with the new MCAT method? And basically, what I'm showing you here is what every student in medical school pretty much does to study for their board exams, the way my MCAT program is structured for our pre-med students to study, because these are by far the most effective techniques. And that is doing practice questions. I have all my students use UWorld. There are other question banks. I personally think UWorld is the best question bank out there aside from the AMC. Other companies do have some good, like I think Next Step tests are decent, or the question banks are decent as well. But if you're just going for a question bank, UWorld, in my opinion, is the gold standard, especially when it comes to medical school. You'll see there's not a medical student that doesn't use it, and they're doing really well in the pre-med space as well. Does anyone here have UWorld or already start UWorld questions? And I'm not sponsored by UWorld, just as a disclaimer, but I do use their, like I give every one of my students a subscription of UWorld for that very reason. All right, and then we're going to couple this with spaced repetition, and I think you all know what's coming next. The way to do that is going to be with Anki flashcards. So if you don't have the Anki app, it's a free app on the computer that you can download. And I do have a couple of videos on my YouTube channel, I think, explaining this, just like how to get started. In my program, it goes much more in depth in how to use it with UWorld. But if you can do a combination of UWorld and Anki from the very beginning of your prep, and then sprinkle in the content, obviously you need to do some content studying, especially if there are topics you haven't covered. But what you should always be doing is questions from the very beginning, and then build out a content schedule that complements that, as opposed to building out a content schedule without any spaced repetition for 3 months, and then all of a sudden you start this type of studying. Is this making sense to everyone? Is everyone with me? Cool. And this, I promise this will save you a lot of time and pain with not knowing how to approach the MCAT. Oh, and when you do start your UWorld questions, don't be concerned when you're getting 40% or 50% on the exams, because the whole point is that you're using it as a nidus to start going into content review and learning. So yes, you haven't seen a lot of this material, but that's okay. That's a good thing. That means you're going to learn it even better, as opposed to just doing, if you were to just study that content alone, you wouldn't learn it as well. All right, last thing, I'll try and get through it quick so we can go into questions, but sorry about that. You need to apply early, apply broadly, and tell your story. These are 3 things that if you do well, you're going to significantly increase your acceptance chances for medical school. So applying early, sorry. I have this image kind of just demonstrate. There's a ton of applicants to medical school. For those that don't know, most medical schools, it's a little bit different this year, are on a rolling admissions basis. That means they're giving interviews out as the apps are coming in. There are potential talks of schools trying to change this, but as of now, that's how the process works, which means the earlier you apply, the more seats are available to interview. That means they're going to be admissions committees, just from a bias perspective, they're going to be less, what's the word I'm looking for? They'll be less strict with who they're giving interviews out or giving interview invites to in the beginning. But as they start to fill up those interview slots available, now all of a sudden they're going to be more strict with who they're extending those interview invites to. So you'd want to get your apps in early. The process is extremely long with applying to medical school. And just statistically, it's shown that the earlier you apply in general, the more likely your chances of getting interviews are. And so I highly recommend, the one thing you could do just to significantly improve your app is apply early. If you've applied months in because, you thought the deadline means that's when you could apply by, and the deadlines are really late. So if you're applying by August, September, October, you're late into the cycle. I have all my students, this year's been different because a lot of things have changed, I'm sure you all know, are applying late June at the latest. If other circumstances come up, then some of them will apply in early July, but that's usually as late as my students are applying. And that's one quick way that you can significantly improve your chances without even doing anything else or changing your application or grades or whatever. Next is to make a good and broad medical school list. So I would look into all these different factors. There's median MCAT, GPA, whether the school is out of state or accepts out of state matriculants. So one way you can improve your chances is be very intentional with where you're applying. There's sites like MZAR, and now for DO schools, there's the DO Explorer, where you can see, does this state school from, let's say, New Jersey, and if you are a New York resident, you might see that that New Jersey school is, because it's a state school, only accepts 2 out-of-state students every year. You probably don't want to waste your time applying to that school. Whereas other schools that are state schools might take half their class from out of state, or a quarter, which is a good amount for a state school. So these are random things you should be looking to do. Apply broadly. I mean, you have to factor in cost, but if you can apply to more schools, that's just going to increase your chances. But again, that also comes with more work. So if you aren't willing to put in the time to write those secondaries thoroughly, and you're just going to copy and paste, then I wouldn't apply adding schools to your list. I would generally say about most students will apply between 15 and 30 schools. It depends, how competitive you are, your location, how many state schools you have, but these are the things you should be thinking about to improve your chances as you're applying. And lastly, you need to properly tell your story. So the goal of the personal statement, and when you're in an interview, you want to be showing why you want to be a doctor and the experiences that you've had along the way that have helped you figure that out. You do not need to sell yourself on why you're going to be the best doctor that ever walked the face of the earth. Because the reality is, you don't know that yet. And if you start listing off all these characteristics and tell it in a personal statement, well, I'm extremely empathetic and hardworking and yada, 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 which every student will do in their personal statement. Remember, the admissions committee members are reading these essays one after another, day after day. They see tons of students talking about this. Why are they going to believe you just because you said you're hardworking? Well, you say you're hardworking, but your GPA doesn't reflect that. Or you say you're empathetic, but nowhere in your essay does it talk about how you're empathetic. So the best way to tell your story is through anecdotes and try to build some sort of emotional connection with the reader. That doesn't mean you have to get too emotional in your actual essay, but it is called a personal statement. So if you can be personal, you can tell stories and connect with the reader in that way. That's going to allow you to have a strong personal statement. And one more thing on that, everyone gets concerned about being unique. And yes, so there are some students that might have exceptional stories, but the majority of students do not have anything that's absolutely revolutionary when it comes to their application and their personal statement. But that's okay, because you yourself are unique. And if you think about, I like the analogy, if you're watching a movie, most movies have the same plot, right? You have the hero's journey, something happens where now it's going downhill, and then it finishes off where they're saving the day or whatever. It's the same thing when you're telling a personal statement. While each movie is got the same story, every movie is somewhat different. And the same with personal statements. While you might talk about an injury is what sparked your passion for medicine, the way you tell that story and what happens after is going to be different because it's you. And I just bring that example up because I see that all the time with students, is like, oh, this is how I first got started. I either had a family member that was sick, or I had a personal injury, and this is how I started learning about the field, etc. And that's okay. It's okay. It's not cliche just because it's common, but the way you tell your story and the ability to actually bring in anecdotes and bring in personal experiences, no one else has those experiences. So the more personal you can make it, and the better you're able to connect with the reader, and because of that, the better that's going to do, and the more likely they're going to want to know more about you and invite you to that interview. So those are 3 things for the application. We covered a lot. We did how to study just for class, how to prepare for the MCAT, and 3 things that you can do to improve your application overall. So with that said, just to close it off, I kind of mentioned this, but I have an ultimate advising coaching program. We help students throughout the entire process. If you are interested in that or learning if it might be a good fit for you, you can go to this link and schedule a call, and it would be with me or someone from my team, one of our other coaches, or you can message me on Instagram if you just have more personal questions that you don't want to write in the chat during this meeting, and I will respond to all DMs. I do get to them eventually. Usually I try to do it pretty quickly, and if I don't, just re-message me. All right, that's all I had to say. Now let's open up into a Q&A. And this is your time.
So you guys can...
Yep.
Sorry.
No, I was gonna say,
you
this is
guys
your
can
time to
post
ask
your
anything.
questions in the chat. Yeah. And I also have a list of questions as well. I think you answered a lot of them, but if you guys have any questions, you can unmute yourself or just post them in the chat. So I know you kind of already touched upon this, but can you just talk a little bit about your own undergraduate experiences?
Sure. So, and I guess this goes to the extracurriculars type question, which comes up a lot. But for me, so I loved Cornell. I had a great time there. I had much more fun than I ever imagined I would going to a school like that as pre-med. And I think the reason being is I was able to figure out systems that work for doing well in class. But I also prioritize things like having balance and hanging out with friends and not making my entire identity wrapped up in just being a pre-med, which I highly recommend because you'll probably end up doing better if you do that, plus all the other study tactics I told you about. So With that said, in my experiences, I added one new thing every semester. And I think I didn't realize I was doing it at the time, but I think that was really good because it allowed me to not overwhelm myself and still be able to focus on academics, which is still the primary focus for pre-meds. And a lot of students actually don't do this. They think everything else is more important. Those grades in MCAT are going to be the biggest limiting factor for most students when it comes to their application. And so focus on grades first. But when I got to Cornell, I joined the club soccer team. That was the first thing I did. Then I joined a social fraternity my second semester. Then I joined a pre-med club like this one. I was in Phi Delta Epsilon, and that was extremely helpful. We did lots of philanthropy events, lots of mentorship. And then I started getting involved in research. So those are the things that I did at Cornell alongside all the classes and whatnot. And then throughout my summers, I tried to get the shadowing and clinical experiences. Someone said, what are some things you like and don't like about med school? The things I like are that you're finally learning the information that you've been wanting to learn. You're finally learning the stuff that will eventually help you save someone's life or treat patients and better their health. And that's really cool. So the anatomy, the physiology classes, microbiology, these things you feel like are so much more applicable to when you get into the hospital than when you're studying organic chemistry and that type of stuff, which you still need to do. And it makes sense looking back like why you had to do it. But obviously I found that less fun than the classes that you get to take in medical school. Some things I don't like. Sometimes it feels there's so many moving parts to med school. I think at most schools, this is, so I don't want to speak for other medical students, but it sometimes feels not the most structured. Like you have classes, but the schedule is constantly changing. So you're doing a surgery rotation and your hours are 5 a.m. to 8 p.m. at night. Then you're on a family medicine rotation and you're working a normal 9 to 5. And then you're on a psych rotation and it's different. And everything's always constantly changing. You have to constantly, so it's hard to keep a good routine, which I really like. Unfortunately, that's going to be the case for residency too, because your hours are always changing and schedules. But that's one thing that I like, being able to wake up early and be on the same routine and go to bed at the same time. And that's a little bit harder to do in medical school than it is in undergrad. Someone said, if you had to rank the following criteria for the most important to least important, how would you rank them? MCAT score, GPA, letters of rec, personal statement, action. Wow, okay. I it's going to be slightly different based on each school. Every school weights things differently, so I can't speak for them. But I would say GPA is more important because it's a 4-year overview of what you're like academically, where the MCAT, many times, if you only take it once, it's just a 1-day, 7-hour sitting. With that said, a poor GPA can be overcome sometimes, depending on how bad that GPA is, by a great MCAT score. Especially, let's say you had the last semester of grades was really good, and then you rocked the MCAT. They might see that and realize, all right, you have a 3.2, 3.3, but you just got a 4.0 semester and you crushed the MCAT. Now we know the most recent snapshot we have of you as a student is really strong. So MCAT, so I would say GPA, then MCAT, and then it's going to be your experiences that you have that actually show you're invested in this field, the shadowing experiences that you have, the clinical experiences you have, that you understand what you're getting yourself into and how you're able to tell that in a personal statement. So that would be the next step down. And then obviously once you get to that point, it'll be your interview. Once you get the interview. Do you have advice on avoiding procrastination? Sorry, did anyone have a follow-up on that?
I actually had a question, but I don't want to cut up on anyone's questions.
Sure,
in the chat.
you can ask, and then I'll go to the next chat one after.
Okay, I just want to know, like, how did you deal with your transition from undergrad to your first year of med school? Because I know that's one of like the many obstacles that a lot of MS1 students tend to deal with.
Sure. So I didn't find it too bad, to be honest. I'm not sure if I was lucky in that regard, and Cornell just prepared me really well. And I also didn't take a gap year, which honestly I recommend most students do take a gap year, but I did go straight through, so I wasn't like out of the practice of studying, although you get back into it really fast. It's really not as big of a concern as most people think if you do take a gap year, 2 gap years or whatnot. But the difference is in medical school, they say it's like drinking water from a fire hose, right? So you're just trying to take in all this information so fast, it's very hard to keep up with. That's why for me, once I learned Anki well, that was a big game changer, which I didn't even know as a pre-med student, and I wish I did. So that was one way I was able to adapt and start learning information well enough that that I can memorize a ridiculous amount of information that got thrown at me. At the same time, though, a lot of medical schools, and mine, fortunately, was pass fail for the first 2 years. So that kind of takes a lot of the pressure off of feeling like you need to be at the top of the class at every time. If the average was an 80 and I got an 85, I was very happy. As a pre-med, I would not be happy with that. I would make sure I need to be doing everything I need to get an A. So that took a little bit of pressure off of it. And I think that's why a lot of medical students or medical schools switch to pass fail in the first 2 years, because it's already stressful enough and they know all the students are type A to begin with. So it's not like people are going to just stop studying, and you still need to do well and pass. And so I was able to transition fine. I think most students are, as long as they have good study strategies from the beginning. If they didn't, and they kind of just got by and somehow got into medical school, those are the students that I think struggle a lot more. What are some tips for burnout? To deal with burnout, I kind of alluded to this, but it's really important to not wrap your entire identity into being a pre-med or a med student or doctor when you are one. You need to find other hobbies and things that you enjoy and do those too, and make it a priority. So for me now, it's been entrepreneurship. This has been extremely fun for me. The mentorship that I've been able to do with students, and it's also like playing basketball and soccer, although I'm on 2 torn ACLs right now, so that's on the back burner for now. But being able to do things that you enjoy, and so your identity is not wrapped up fully, like all you are is a pre-med student and all that matters is your grades. Not that they're not really important, but you can't see your entire life as just that. And I think that helps avoid burnout. And when you're feeling, sometimes you just need to take breaks and have more time for yourself. And if you feel that coming on, or you're feeling like you're struggling mental health wise, it's okay to seek help, because this is a really tough field. Honestly, it has, I mean, they've shown statistically one of the highest depression rates when you're like a resident or med students and residents. So out of other careers. So you need to be able to find balance and do things you enjoy, and not give everything else up in your life just because you feel like you have to constantly study for an exam. And ironically, you'll probably end up doing better when you are taking care of yourself and doing the things that you like.
Going off of that, how do you have any tips on avoiding procrastination? I feel like I have so much motivation to study, but then the second I like start studying, I just get distracted. I get distracted and then I procrastinate all my work.
Yeah. So, okay, first, I find that the waking up early and doing work in the morning at 6 a.m., I promise there are no good TikToks out or Instagram posts. So if you wake up early and you get your most important work done for those first 2 hours, then even if you have a bad, let's say, next set of studying, you've been productive for the day, and you'll get better and better at this. Also, the environment you set up for yourself when you study is going to determine how well you study. So if you have your phone on and it's on your desk, you're going to procrastinate. I guarantee. I like, as good as I am at doing work, when I fall into periods of time where I start to get worse and worse, because I'll start studying with my phone near me and you just instinctively reach for it. Or even if I have my computer not blocked out from certain sites, I'll just go to my email, and then there's an email and I get sidetracked. So basically, you need to set up your environment so you have no choice but to study. So what I do when I really need to do deep work, phone's in either another room or it's completely off. And even if it's off, it's not an arm's distance. Then I use the self-control app on my computer and block out Facebook, email, Instagram, any of those sites. So when I'll you know how addicted you are to these devices. You'll see if you ever do this. And midway through my studying, I'll just naturally like type in Facebook, click enter, but then it blocks it. So I literally cannot go to the site. And I'll be like, wow, that's pretty embarrassing. But basically setting up your environment so you can't fail will allow you to prevent that procrastination, because otherwise it really is hard to fight all the stimulus that people have in today's environment. Does that make sense?
Yes, thank you so much.
For sure. All right, I see. Any advice on picking a specialty? You need to try out different things. I promise you won't know what you like and the lifestyle you like until you really see it firsthand. And so you get to do a lot in your third year rotations, but I do recommend make sure you can get exposure to fields that you might not in your third year. So for example, and one of the reasons I even took a gap year is I just wanted to get a couple more exposure to a couple more specialties before I made my final decision, because I didn't really get to see pain management. I didn't get to see emergency medicine. Most schools do have an emergency medicine rotation. My school did not for whatever weird reason. And so dermatology, orthopedics, some of these specialties, you're not just going to get that experience. So in your first and second year, try to get some shadowing experience, because once you're a med student, it's a lot easier to be allowed to just shadow whoever you want and in which departments, and do that early on so you can get exposure to as many specialties as you can. How do I manage being an entrepreneur and in medical school? It's truly something that I love to do. Like, I absolutely love the entrepreneurship stuff. And because of that, it's like my hobby. So like when most people are watching Netflix, I'm reworking my website, or, working with my coaches on how to improve our program for the students. Because I love it that much, it was my way for balancing. But I think if it wasn't like your hobby or something you're passionate about, I wouldn't recommend it. But that's how I've been able to do it. And because I'm so excited and enthusiastic about it, it was like, it just kind of naturally happened. And there were times that I would, probably put in too much time into entrepreneurship stuff. But when I needed to crack down for medical school, I was making sure to get that done. So that's kind of how I've been able to manage it. And I have a good team around me now that really helps. What should never be included in a personal statement? I would avoid anything that comes off as condescending or really braggy, which people don't always realize. Also, negativity. I would try to avoid negativity. So for example, a lot of people will write about how they had a terrible experience with a doctor and they're never going to be a doctor like that, and that's why they wanted to be a doctor. That doesn't really make sense to me. Like, shitting on a doctor, excuse my French, and then saying like that's why you wanted to be a doctor. I like kind of get the connection you're trying to make, but it comes off as negative. A lot more students do it than you would think, and I would be careful with something like that. Anything like that, or anything where you're like, I know I'm gonna be a amazing doctor, because that's like, I just would avoid where you're just making these grandiose statements without anything to back it up. You're much better off showing through stories and letting the reader come to their own conclusion. Because when they come to the conclusion themselves that you're empathetic and that you're hardworking, they're going to believe it because they made that conclusion. When you just tell them, people don't want to be told what to think. And so when you state these things, it doesn't come off as good. So I would try to avoid that type of writing. Certain college majors set you up for success as a future med student. I would say the majors where you have to take upper level bio or science classes like anatomy and physiology, microbiology, immunology, pathology, going into medical school with those classes already taken in undergrad is a leg up, and it's helpful because you're going to take those classes in more depth in med school, but they're not completely necessary, and you can still do well no matter what major you were. If you know how to study properly, you'll be fine. If you want to highlight issues in medicine, that's different. Just be careful the way you write it. You don't want to sound like you're just complaining about the way the system is. You want to show that you want to be passionate about finding solutions. It's definitely important, and honestly, this comes up a lot in secondaries anyway. It might even be asked about. Just be careful when you read through it again. Try and read it in the mindset of like, am I coming off as negative and I'm just complaining, or am I coming off as I'm acknowledging issues that exist and I want to be a part of the solution?
Do you know what kind of specialty you want to go into yet, or you're still unsure?
Right now, so I always thought I wanted to do orthopedics. I'm still debating on if I want to go the surgical route. The other options that I'm exploring would be like pain management and rehabilitation, and then a sports medicine fellowship or emergency medicine. So I haven't fully picked yet. Still trying to keep the options open, but I always thought I was dead set on ortho. So even just the fact that I'm trying to keep my options open is something I would recommend until you fully commit.
Yeah, that's a good idea. I've always been interested in surgery, like for a while now. But I mean, obviously, until I get into med school and see how it works and stuff.
Exactly.
It
And
depends on seeing.
you want to be in the OR, see if you like the culture, see if you like that type of work. You really are just, it's different. Even if you like hands-on work, it's still different hands-on work. There's like, for example, pain management, you could do a lot of hands-on stuff, injections, etc., versus being in the OR, which is a much different environment.
Yeah, for sure.
So Justin, I'm still trying to figure out what drew me to each of the options. I mean, those, I think all three would be the best fit with my personality, with my interests. It would be hard for me to go into the specifics of every single one right now. But emergency med's definitely a great specialty. It's people like it because of the shift work, and you're very hands-on. You're front line, so a lot of benefits. There's going to be benefits and drawbacks no matter what specialty you go into. So you just want to do your homework and make sure you like the people that are in the specialty, because every specialty kind of has a different culture, and yeah. I don't think there's someone asked about scribing. I don't think there's any school that doesn't like to see scribing. It's very common for pre-meds to do, so it's not going to like be a major differentiating factor, but it is a good experience and could be a good position in a gap year, or if you can during a semester. But again, sometimes the hours with scribing are tough, so I wouldn't do it at the cost of grades.
Yeah, for whoever was asking about the scribing, I'm actually a scribe right now. I'm able to manage. I'm still a sophomore in undergrad, but for whoever wants to know about it, it's actually a great experience. I'm in emergency medicine, and I get to shadow a bunch of different physicians and be able to get a lot of firsthand experience. So if that's something you guys are looking to get into, I think it's great for whoever was asking.
Awesome. All right, guys. Hope this was helpful. I hope I delivered on my promise of the one tact. Actually, can I hear in the chat, what's the one thing you're going to try and change moving forward from something we discussed today? Studying earlier, practice exams early. All right, cool. Love it. All right. And again, if you want more of this type of advising and accountability, and then if you're going to get a full MCAT program anyway, an admissions program, you can schedule a call at that link and see if it would be a good fit. Or if you have other like personal questions, you could always message me on Instagram, and I'm happy to help.
All right, thank you so much for the incredible and insightful session, Adam. I personally really enjoyed how interactive and encouraging you were, and I really hope to hear back from you in the future. If you want to post your social media handles or links to any of your business endeavors in the chat, you're more than welcome to do that. To our Wayne State University students, please make sure you complete the Google survey posted in our Zoom chat, summarizing this entire session to obtain your shadow hours. Thank you all, and I hope you guys have a great night. Please stay on the call for 5 minutes, not Adam, but just the students, to make sure that the survey is working for you.
All right. Thanks, guys. Have a good one. Hope you all have a great semester, and good luck.
Thank you, Adam. Have a good one.
You too.